I would like to begin by acknowledging the traditional owners of the land on which we meet today, the Turrbal and Yugara people, and pay my respects to their elders past, present and emerging. I'd also like to thank you, Marg, for inviting me and my family to participate in this conference, for making us feel so welcome, for giving us the opportunity to meet and talk to old friends and to make new connections, and to immerse ourselves over a couple of days in family capacity building and inclusion. Engaging in your conference theme of building capacity for lifelong inclusion has been like drinking from a fire hose. Lifelong inclusion is essential for good quality and safe lives for us all, but especially for people with disability. I'm a huge admirer of CREW and your work, and also the other members of the National Alliance of Capacity Building Organisations. You all make outstanding contributions to our society. I'm therefore especially grateful to Margaret Ward, who introduced me to CREW about a decade ago. I've also had the pleasure of working with Marg closely on reform to the National Construction Code to ensure that all new housing is accessible. This has been a decades-long crusade that Marg has waged in order to ensure that for future generations, our housing is accessible. It has been and continues to be a David and Goliath battle as a small group of activists and researchers, only armed with evidence, fierce determination, and voices which will not be silenced, fight the housing industry, which wants to ignore the long-term benefits of future-proofing Australian housing, not just for people with disability, but for all Australians who want to age in place. And the buildings industry's response has been that all they want to focus on is minimising the short-term cost of new housing. I'm pleased to say that under Marg's unifying and determined, just and decisive leadership and continued vigilance, we've had some remarkable successes. And as a result, the National Construction Code has not only been changed, but building regulations have now been changed in most states in Australia. The battle is not over, but it's part one and has been hard fought. And this brings me to my purpose as this conference closes, and the key messages which I would like to leave with you. My messages are that united we stand and divided we fall. Individually, we are powerless, but collectively, we are very powerful. With clear purpose and together, we can make a difference, not just to inclusion, but to disability policy and also the NDIS as its reform journey continues. I first became interested in what is now the NDIS in 2005. So for me, this has been and continues to be a 20-year crusade of thinking about the scheme, designing the scheme, governing the scheme for 3.5 years, and most recently, as co-chair of the NDIS review, setting up a framework to reform the scheme so that it achieves its original purpose. At the time that I first became interested in the NDIS, I was chair of URELA, then Victoria's largest disability service provider. As a board director, we regularly visited the services we provided. And in 2005, I went out to one of our early intervention services. It was located in a suburb called Endeavour Hills, which is near Dandenong, and if you know Melbourne, you'll know that that is one of the poorest suburbs in the city. And I sat down on the floor and started to chat to this mum, and she said to me, "Why can't my son get the early intervention services he needs?" And my response, I'd started to chat to her and I said, well, look, here at Urella we're doing everything we can to make sure that we can provide the best supports we can, not only to your son, but to all children with disabilities. And I explained that how our staff were enrolling more kids in our early intervention services than they really should have, just to make sure that these kids got some early support. But when I went away from that brief encounter, I was in fact deeply ashamed with my response, because I'd immediately become defensive and I was justifying a status quo that could not be justified. And so without much real thought, I decided I wanted to change this. I wanted to make sure that people with disabilities will get the supports they need, based on their needs. I was fortunate that at the time I was a director of a new organisation called the Disability Housing Trust that had been set up by the Victorian government to innovate and create new types of housing for people with disability. The chair of the Disability Housing Trust at the time was Brian Howe, who had been our Social Security Minister in the Hawke and Keating governments, and then been Deputy Prime Minister when Paul Keating became Prime Minister. He'd continued to remain active and interested in policy and policy reform. And so I went to see Brian and I said, well, what do I do to fix this? And he said to me that the first thing I needed to do was to stop thinking about disability policy as welfare and to start to think about it as an investment and insurance. I'd spent much of my professional life in the funds management and insurance industry, and I immediately understood what Brian was saying to me. He was saying we need a social insurance policy where we all contribute a small amount of money to the cost of the scheme through our taxes, and then we would all be insured in the event that we had a child born with a disability, we ourselves acquired a disability, or this was something that happened to our grandchildren. So I was immediately attracted to this idea. Brian gave me some introductions, and through those introductions I met John Walsh, an actuary who had done some groundbreaking work on how we could extend existing accident compensation schemes that operated in the event of a motor vehicle accident or a workplace accident to all types of injuries. And so I asked John, could we do the same? Could we extend this idea to all people with disability? And John, being an actuary, said, of course, Bruce, as long as we can get the data. And so we started to work together on this idea. In late 2007, we had some luck. There was a new Labor government. Bill Shorten had been appointed as Parliamentary Secretary for Disabilities, and Jenny Macklin, who had worked as an advisor for Brian when he was a minister, had become the Minister for Social Security. Very early in 2008, I got a call on my mobile phone from an unknown number. These were the days when you answered the calls from the unknown number. So I answered it, and the voice said, Bill Shorten here, Bruce. So my immediate thought was, I better save this number. Could come in handy over the next few years. And he said, look, I want to set up a group to look at how we might invest in people with disability, which he called the Disability Investment Group. And so we got this group together, which included John, to do the first work on the NDIS. At the time, I said to Bill, look, we've got this great idea, we'll do a little bit of work, and then you can just implement it because you're now the minister. He said, Bruce, it doesn't actually work like that. He said, there are two things that we need to do. The first is, in addition to doing all the actuarial and other work that we were going to do through the dig, we need to build a coalition of the willing, because without that coalition, we won't get change. So he was telling me that to be powerful, we needed a strong group of people all working together. The second point, second thing he told me was, he said, look, Bruce, I used to go on to building sites and I'd say to the workers, we've got a choice here in terms of the reforms we're trying to get. We can spend all of our time on the 90% we agree on and get it done, or we can spend all of our time on the 10% we don't agree on and get nothing done. So in big reforms, there is a need to compromise while holding true to the ultimate direction that you want to go, but you don't get everything. So building a coalition and focusing on the 90% and then building the evidence was what we went about doing in 2008 and 2009. In April of 2008, Kevin Rudd, who was then the Prime Minister, convened the 2020 summit, where he wanted to collect the best ideas for reform from around the country. Two friends of mine and I decided that we would write a submission to the 2020 summit. None of us attended that summit. We weren't invited. But for that submission, I coined the term National Disability Insurance Scheme, which has held true until today. Somehow, amongst all the confusion of having 1,000 people together, the NDIS emerged as one of the big ideas. But that was no accident. Helen, John and I rang and emailed every person we knew who was attending the summit and said to them, look, I know you're coming to the summit with your big idea, but there's a second idea. If your big idea doesn't come up, then go for the NDIS. And as a result of that, we did in fact have that emerge as a key objective from the summit, a key recommendation from the summit. Soon after the 2020 summit, I met Rhonda Galbally, who was then chair of the National Disability and Carer Council. She and her deputy on the council, Kirsten Dean, were working on a report which became the Shutout Report. Many of you will have read that report, which showed that people with disability were no longer shut into the Dickensian institutions in which they had once been housed, but were now in the community, but not included in the community. They were shut out. And so together, the Shutout Report, which presented the problem, and the DIG report, which presented a potential solution, led to the Productivity Commission inquiry into the NDIS, which was held in 2010 and 2011. During that period, Rhonda and I also created the National Disability and Carer Alliance, which brought together the Australian Federation of Disability Organisations representing people with disability, Carers Australia and National Disability Services. Because before the NDIS, the disability community was deeply split. It was balkanised, and people were not used to working together. And Rhonda and I knew that without unity, we would never get an NDIS. Through the National Disability and Care Alliance, we auspiced the Every Australian Counts campaign, a grassroots campaign. The only real asset we had were people and their stories. And it was those stories told with immense dignity which changed Australians' perceptions of how we support people with disability and ultimately led to the NDIS. It was a campaign which cost just $4 million, funded by disability service providers. But as I say, our only real asset was the people who told their stories, who built support one by one. And at its peak, the campaign had over 150,000 active supporters. The scheme started on the 1st of July 2013, and between the Productivity Commission report and its start, there was work done by a COAG Advisory Council, and as Lorna indicated, she and I were fortunate to be members of that advisory group through that period. As I reflect on the introduction of the NDIS, which in reality took a very short period of time, just 8 years from when I first started to think about it to when it happened. And one can argue that there were things done before, but in a relatively short period of time, we got an NDIS. As I think about it, there were five factors that were key to its introduction. The first will not be a surprise to you, given what I have said so far. It was all about unity, building a broad coalition, finding champions. And I draw a distinction between champions and supporters. Champions are people who will make a call, who will actually do things to make change happen. The second important aspect to reform was our use of language. The term insurance meant that the scheme was relevant to every Australian, not just people with disability and their families. And the language of the Every Australian Counts campaign told every Australian that there were people in this country who don't count. The third element was that we framed this as an economic reform, not just a social reform, because every reform and every large reform has to run the gauntlet of Treasury and Finance departments. The fourth element was effective communication. The Every Australian Counts campaign used electronic communication brilliantly. They emailed the members of the EAC, and as a result, in advance of key COAG and other meetings before the NDIS was introduced, the Premiers and the Prime Minister literally had thousands of emails in their inbox urging them to do the right thing. And the final aspect, which I think was critical, was that we made the NDIS apolitical. We wanted all political parties and all governments to support it, because otherwise we would have had a seesaw policy where it came and it went, and that would not be fair to people with disabilities and their families. I think these 5 key factors are actually universal truths when it comes to reform, especially big reform. As I reflect now on where we are, the change in the last 12 years since the scheme was introduced have been simply extraordinary. The NDIS is changing the lives of people with disability and their families in truly remarkable ways. It's a world-leading reform, even with its challenges. It has become embedded in our society and is as strongly supported as Medicare. But the NDIS has also been a hugely disruptive force, and so some things that have been lost as a result. One of them is social and community capital and the critical role it plays in supporting people with disability. Another is early intervention, which has shifted from a family-centred model to a clinical model and needs to come back to a family-centred model. A third factor has been that mainstream services have shifted costs onto the NDIS, amongst those education and health. And as a result, the NDIS has become unsustainable, on a path before the latest reforms to costing $100 billion or more. I was therefore greatly honoured when Bill Shorten invited me to co-chair the NDIS review in 2022 and 2023. It's not often in public life that you get a second chance, and so the opportunity to work with an extraordinarily talented co-chair and independent panel and an extraordinary secretariat was one of absolute pleasure as well as great honour. And I know that Lauren Gill, who was a member of our secretariat, is here today, and I just want to thank Lauren and all the other people in the secretariat for an extraordinary job that they did supporting the panel and supporting the co-chairs. Our terms of reference were threefold: to put people with disability and their families back at the centre of the NDIS, to restore trust and confidence, and to ensure that the scheme is sustainable. In total, we made 26 recommendations and suggested 137 actions. And we told governments that this is a package of reforms because everything is related to everything else. And if you start to unpick those reforms, then the whole package could unravel. Since we provided our report to government now 15 months ago, legislation has been introduced which is consistent with the review. As you would know, it's largely in the form of enabling legislation, but some further changes have now been put in place, most importantly the changes to Section 10. But there is still an enormous amount to do. First and foremost, the system of foundational supports that we recommended to ensure that all people with disability receive support based on need is yet to be put in place. Consultations have been held in relation to general foundational supports and targeted foundational supports for children, but we're still waiting for those foundational supports to be put in place. It's clear that there is an agreement between the Commonwealth and the states to jointly fund those foundational supports. They haven't happened yet, and I suspect they will only happen after the election when a deal is done on health reform, which is then linked to these NDIS reforms. The second area that needs to change is to shift the access criteria for the NDIS from medical diagnosis to functional assessment. This was always the intention of the scheme, to make sure it was only the people with the most significant disabilities who received the individualised supports that the NDIS provides. The third area of reform that still needs to be completed relates to budget setting and the participant pathway. Supports need to be based on support needs, not functional assessments. And the fourth area that needs to change is the way the NDIS market operates. Lorna referred to the challenges of the NDIS marketplace yesterday. It's not surprising that we have these challenges, given that effectively what's happened is governments have just let the market rip. You only have to look at vocational education and other areas to see that if you let the market rip, particularly where you have vulnerable clients and participants in those markets, or customers as they're sometimes called, they're likely to be exploited. So a key area of reform that needs to now happen is there needs to be much more active market stewardship, there needs to be stronger regulation, there needs to be much greater focus on outcomes, and in particular, there needs to be much greater focus on what is a good life. And a good life is made up in part through paid supports. But as you in your conference have identified so clearly, a critical part of a good life is informal supports and social and community capital. So we need to make sure that the market settings support building that social and community capital. This needs to apply to the way foundational supports are structured, the way they're commissioned, the way that navigation is structured and committed and commissioned, and also in the way prices are set. Prices that take no account of quality, of outcomes or of safety are a risk to us all. I know that the legislation changes last year, and in particular the changes to Section 10, have left many of you tired, fearful and exhausted. And here I am saying there's more change ahead. I also know that talk of sustainability adds to fears and creates uncertainty. And so how should you respond to the changes which are coming? But even more importantly, how could you work together to influence and shape those changes? I recently attended a leadership conference at the University of Melbourne. The context to that conference is important because universities are currently facing an existential risk. They've lost the trust and confidence of the Australian community because the degrees that people receive are seen as too expensive and the quality of teaching is seen as poor, and the research is seen as largely irrelevant to the future of most Australians. I would suggest there is an essential lesson that the disability community can and should learn from universities. The one thing that we cannot afford to lose is the trust and confidence and generosity of the Australian community, because it is our fellow Australians that pay for the NDIS. As Simon Duffy said during the NDIS review, we must at all costs avoid the tragedy of the commons. The tragedy of the commons is that everyone thinks they're entitled to graze their cattle on the commons to the point where the commons don't exist at anymore. But now, returning to my University of Melbourne conference, we were addressed by the university's new Vice-Chancellor, Professor Emma Johnson. She's a marine biologist, and her research has led her to closely study marine communities undergoing change, often human-induced climate change. She said that in her research, she's noticed that marine communities adopt one of two strategies to change. They either fight it or adapt. And her advice to the universities was that maybe we need to think some more about how we adapt as universities to the fact that the Australian community has lost trust and confidence in us. I think the parallel for the disability community is to recognise that change in the NDIS is not only inevitable, it's essential, because today it's neither equitable nor sustainable. So we need to adapt. The second observation from Professor Johnson was that communities that are the most diverse and communicate best adapt the best. I would like to suggest that in the months and years ahead, we need to use the strength of our diversity and communicate effectively to shape the reform path. And so this is what I would like to encourage you to do as you leave this conference. As you leave, I'd encourage you to especially reflect on CREW's name, Community Resource Unit. CREW both is a community resource and a community, and it's been a pleasure to be a part of that community over the last couple of days. So how can you all work together to strengthen your role and have greater impact as a community? How can you support each other? Reform is a marathon, not a sprint. The reform path is generally not straight or straightforward. There will be dark days and there will be setbacks. So in those dark times, I would suggest that in addition to drawing strength from each other, also draw strength from those who have come before us, the disability pioneers who have led us to where we are today. We stand on their shoulders. Building capacity for lifelong inclusion is essential for good and safe lives. So take the theme from this conference, spread the word systematically and strategically. Be united, strong, resolute, and above all, courageous. Together, we can continue to improve the lives of people with disability and their families. Together, we can continue to make Australia fairer, and together we can continue to make Australia more inclusive. Together, there is hope and opportunity, and together we can make a really big difference. Thank you very much.